Tell me one.
All right, go ahead.
Hi guys. So today we're going to be presenting on Pierre Robin Syndrome um, with my fellow colleagues, Ashay, Nia, and me. You can go to the next one. So Pierre Robin Syndrome is a condition that occurs before or after birth. The condition is visible when you are born as a child. Normally, you would see the size of a child's mouth or jaw. It's normally smaller than other newborns. Another sign can be like a cleft palate in the mouth, which is like an opening in the palate, obviously, and it affects the child's eating and breathing. Um, Also, at birth, you might not always be able to diagnose a child of this condition. So sometimes another sign is natal teeth. I've never heard that before. So when I was doing the research, I actually learned about what natal teeth was, which means that the teeth are visible at birth. So I thought that was very interesting. They also sometimes have a U curve in their jaw and their teeth pattern, which makes their teeth seem normal than other infants. And then another thing is that they tend to have temporary hearing loss as another sign of the Pierre Robin syndrome. Um, it's because the reason why they have the temporary hearing loss, is because there's fluid built up in the middle of their ear. So after they grow, I would say about 3 to 6 months of them growing, they can their hearing goes away, and they'll finally be able to hear. You can go to the next slide. So even though, so Pierre Robin syndrome, it's not fully found on why it's caused um, to children, but so they haven't really found out why kids have it, but they noticed that they have similar development patterns in newborns. And I found information on the Cleveland Clinical website that newborns with Pierre Robin syndrome have a tongue that tends to fall in like they tend to fall towards the back of the throat due to their small jaws. It's also like a mutation gene, so maybe like a gene is like one of them is incorrect compared to another one. Um, and I and they also said that it can also be caused because of lack of vitamin B, which is also known as folic acid deficiency. Um, so that's another reason, and also just the fetus not having enough room in the womb. That can also cause children to be born with Pierre Robin syndrome. But then again, like I said earlier, that their condition is like not fully known why kids are born with this, but it's not like it's not fixable. It definitely is fixable, but it just takes a lot of therapy and treatment for it.
Okay, so as far as diagnosis and treatment, um, diagnosis wise, the signs of PRS can be seen prenatal at the ultrasound or MRI. Usually the doctors see it once the baby is born. Um, it can't really be mistaken. So they'll see the small jaw, and that the child has breathing problems. A specialist will work with other healthcare professionals to test the patient. So they'll use a tiny camera to look at the baby's airway and its branches, voice box, and the back of the baby's nose and mouth, measuring oxygen levels in the blood tests, breathing tests, imaging tests like CT scans, MRI, X-rays, a sleep study, and a feeding study, as well as genetic testing, just to see what's been going on a hereditary scale. The treatment, the doctor will watch the baby's development with ultrasounds during the pregnancy, and then after birth, a cranial facial specialist will be recommended. Usually, surgery is needed. So let me show you this video that kind of explains a little more.
Pierre Robin sequencer syndrome is when kids are born with an abnormally small lower jaw, a larger than normal tongue for the size of the jaw, and sometimes cleft palate. About 2/3 of kids who are born with Pierre Robin sequence have a cleft palate. The diagnosis of Pierre Robin sequence is often made based on history and physical examination. Historical features such as difficulty breathing or stopping breathing during the night can occur. The other thing that we concentrate on is a child's ability to feed, because if the child can't feed, it's hard for them to grow. And the feeding and the breathing issues can go hand in hand. If your child has Pierre Robin sequence, our team may decide to order a number of tests. One of the tests is a polysomnogram or sleep study in which we will measure the level of oxygen that your child is getting while sleeping. This also gives us some information about what the brain is doing while your child's sleeping, as well as the heart and the lungs. Another important test to do is a microlaryngoscopy and bronchoscopy, which is a test in which we stick a very small fiber optic camera into the airway and watch your child breathe. This gives us a lot of information about the anatomy of the airway, which will help direct care as we move forward. The last test we might order is an X-ray of the head and neck, which will give us information about the anatomy of the jaw, as well as its size relative to other structures of the head and neck. Because there's a wide variety, our team may decide to order a number of tests. One of the tests is a polysomnogram or sleep study in which we will measure the level of oxygen that your child is getting while sleeping. This also gives us some information about what the brain is doing while your child's sleeping, as well as the heart and the lungs. Another important test to do is a microlaryngoscopy and bronchoscopy, which is a test in which we stick a very small fiber optic camera into the airway and watch your child breathe. This gives us a lot of information about the anatomy of the airway, which will help direct care as we move forward. The last test we might order is an X-ray of the head and neck, which will give us information about the anatomy of the jaw, as well as its size relative to other structures of the head and neck. Because there's a wide variety of patients who have Pierre Robin sequence, there's also a wide range of treatments. Most mild cases of Pierre Robin sequence can be treated with prone positioning alone. That's when a child sleeps facing downward. By sleeping facing downward, the base of the tongue is brought forward, which will allow them to breathe more easily. More moderate or severe cases of Pierre Robin sequence are treated with either tongue lip adhesion, mandibular distraction, or a tracheostomy. Tongue lip adhesion is when the undersurface of the tongue is sewn to the lower lip. This brings the tongue base forward and can be applied in moderate cases of Pierre Robin sequence. Mandibular distraction osteogenesis is a technique in which we actually elongate the abnormally small jaw. By bringing the chin point forward with this technique, it drags the tongue base forward to relieve airway obstruction. Our plastic surgery team has a tremendous amount of expertise in treating Pierre Robin sequence. We offer the full range of treatment modalities that are used throughout the United States and the world to treat this problem. If your child has Pierre Robin sequence, they may see a number of different specialists here at CHOP. Our team has an extensive experience with this, and in fact, we're one of the largest volume centers in the country. Our multidisciplinary team of experts creates a customized treatment plan for every child. And then we reevaluate as they continue to go through childhood and grow, so that at every time point, we optimize their outcome.
Okay.
Pierre Robin sequencer syndrome.
So the possible problems in general that usually the children will have, babies with PRS have an increased risk of heart conditions, and doctors will recommend echocardiogram. And this test looks at the anatomy and the blood flow in the heart. They also might have an increased risk of eye problems. Doctors will recommend an eye exam. and I'm pretty sure often throughout the ages of the child growing up. Breathing problems are possible and can decrease the oxygen getting to the brain, and that might cause brain damage. Feeding problems can result in the baby having poor weight management. Either they're malnourished or they're eating too much.
Okay. How PRS affects speech. So PRS affects speech in ways that a child may produce atypical consonant productions such as the M, N, and ing sounds. PRS also results in the child having impaired control of the movement of their tongues. A child with PRS also experiences hypernasality when speaking, especially with the M, N, and ing sounds. These challenges in phonation and resonance are due to the incomplete closure of the palate, which results in speech distortion. PRS also affects speech development in children. Concerns with intelligibility would arise, and the concerns with intelligibility arises, and they're caused by the structural abnormalities in the mouth and the palate. Next, okay. So SLP support with Pierre Robin Syndrome. With SLP support, they assist in feeding therapy by working alongside with parents and caregivers to develop techniques that will ensure safe and efficient feeding. These techniques include positioning and pacing so that the child doesn't choke during feeding. SLPs also monitor growth and development by keeping track of the child's feeding skills, motor function, speech development, as well as early intervention. They also assist in speech therapy by implementing techniques that target speech sound production, resonance, and intelligibility that the structural abnormalities may cause. And they also provide education and support to parents by informing them and providing strategies and resources that would promote communication and feeding practices at home, as well as in clinical settings.
Okay, so here are our resources, and thank you for hearing us and our presentation. Have a good day.
Thank you.